Thank you so much, everyone, for attending. Welcome to the info session for the 2025 to 2026 round of the T-CAIREM Health Data Nexus Dataset grants. This is going to be our second time we've offered this set of grants. It's been a really great initiative for um, both sort of promoting what we do with our Health Data Nexus platform, but also being able to spread the great research that all of you are doing to a larger audience. So we're really excited to bring another round of this grant to all of you. So I'm going to get started. First off, I'm just going to do a very brief overview of who we are at T-CAIREM and what the Health Data Nexus is. I'm going to talk a little bit about what the process is like for, if your project is selected, what the process is like for uploading a data set to Health Data Nexus. And then we'll take open questions. I have a few questions that I've prepared, sort of FAQs. But we can go over those. We can take your questions. We'll keep this quite freeform after the initial segment. This grant is sponsored by T-CAIREM, the Temerty Center for AI Research and Education in Medicine. If you're not familiar with our work, we are a research center based out of U of T and specifically based out of the Department of Lab Medicine and Pathobiology out of the Temerty Faculty of Medicine. We have sort of three main themes, four main themes if you count the kind of overarching theme of community that kind of encompass the work that we do here. And those are education, research, and infrastructure. The Health Data Nexus is really sits within the infrastructure theme. This is where we kind of work on data infrastructure and improving our capacity for hosting data and sharing that data with members of the research community. And this dataset grant really falls sort of squarely under the intersection of the research and infrastructure themes with this grant that we're offering. So we're really excited to be able to offer this and indeed to offer all that we do at T-CAIREM. If this is your first time, getting involved with a T-CAIREM project, or if you want to learn more, do feel free to check out our website and as well as our LinkedIn and other social media. We have a great newsletter that really keeps you up to date on everything going on, and there's links here that you can check out if you're interested in learning more. Um, so having said that, let's talk a little bit about Health Data Nexus. This is a project that has been ongoing at T-CAIREM basically since the inception of our center in late 2020. Um, One of the first kind of real target priorities for T-CAIREM was identifying the need for a robust data environment for research and education in medicine. There are a lot of data environments out there. There are a lot of, you know, catalogs of data and platforms that exist to share that data, but we find that many of them are restrictive as far as their data access goes, or they don't kind of offer the breadth of data that we're looking to provide with Health Data Nexus. Health Data Nexus aims to be a centralized data repository for accessible health data, and our long-term goal is to be the leading open health data and analytics platform in Canada. Um, and what we're doing this with this dataset grant is really trying to continue to build our capacity and build what we can offer on Health Data Nexus by ultimately trying to increase the amount of data that we offer on the platform. So to get a little bit more technical, you can sort of think of Health Data Nexus as sort of two applications put together. One is a data platform. You can think of this as a catalog of data in addition to the tools you need to credential access to that data. This is where we post the data, where we post information about, what the data is, how it can be found, how it was collected, everything like that. But there's a second part to this as well, because Health Data Nexus is also an analytics environment. Once you've gone through sort of the data access platform part of the equation, once you've become a credentialed user and you've gained access to the data, you are able to spin up a research environment that meets your needs for computation and analysis. And this sort of creates a walled off secure environment where you can do all of your analysis. Ultimately, there's a few things we're trying to build with Health Data Nexus. Firstly, removing risk. It's really important that when we're dealing with Health Data Nexus, when we're dealing with health data, that we want to be as secure as possible because this is sensitive data, of course. We only store de-identified data, and we prohibit data egress technically and legally. The analytics environment that you create, you cannot download the data set, you cannot copy it to your local machine. It is only available within that analytics environment. But we also want to accelerate research. We have what we believe to be a transparent, streamlined, and equitable access policy. Ultimately, we want this to be a place where any member of the research community from all over the world can easily, become a credentialed user and get access to the data that they need to promote their work, as well as to promote their educational initiatives. This is another big thing about the platform. We are not just for researchers, we are also for instructors, educators. We're host datathons and workshops. And indeed, the data that gets hosted on the platform as part of the Dataset grant, we hope to use as part of our ongoing series of Toronto Health Datathons. And we will ask and call upon the successful recipients to kind of help contribute to that process and help, either speak as a keynote or provide their data to one of our upcoming datathons. And then lastly, we recognize that a data platform can only be as successful as the computing resources that's behind it. So we also integrate with commercial cloud services. In our case, that's Google Cloud, to provide high quality compute. So when you go to create your analytics environment, you can scale your compute to the level that's needed, up to sort of the sky's the limit because we're working with a commercial cloud provider, and that gives you the resources that you need to undergo high-powered computational processing. And there's a little diagram here as well that sort of outlines the process as well as the governance and protections that we have in place. I added a slide basically just to talk a little bit about what the upload process is like. I expect this is where we get most of our questions, so I just wanted to spend a moment to talk about this in a little bit of detail. Assume that you are successful in the Dataset grant. What would that actually look like, and what would the process be like? Well, the first step is REB approval. With any REB of record, that can be at U of T, but it can also be at your home institution if you're at a different institution. Once you have REB approval, we'll also, if it isn't through the U of T, we'll also get that sort of submitted for administrative review at U of T, just so that the U of T REB is also in the loop about the new data set. The next step is de-identification. Now these two could be interchangeable in order. As you're creating the data set and as you're kind of going through the process, you will need to provide a de-identified version of the data for upload on Health Data Nexus. We have de-identification guidelines that sort of walk you through what that looks like, but we're also available, like I'm available and T-CAIREM staff are available to answer any questions that you might have about what that process looks like. Next up is a data transfer agreement. This would be signed between the U of T and your home institution. If your home institution is the U of T, then we'll sort of do an abbreviated version of this process where we sort of do a data transfer MOU. But we have a template of what this looks like, and this process will hopefully be relatively simple. We can review the existing template, and then if there are any questions or any changes that need making, we can go through it step by step. And then lastly is the dataset description and metadata. I'll share my screen with the Health Data Nexus on it in a little bit, just so that you can see what that looks like. But essentially, each dataset that goes on the platform has its own data page, and the data page includes a bunch of information describing the dataset, how it was collected, essentials, a description of the actual data, any relevant research or supplemental information that might be necessary, a little bit of information about how it was collected, how it was de-identified, etc., etc. So all of that will be a process that will, again, help walk you through. We have a template for the dataset description, and you'll just be able to fill that in based on the results of your research. In fact, a lot of the information in the dataset description will probably be it will probably be directly the same as the information that goes into the grant application. So you'll be able to use a lot of the same info there. And then lastly is just the upload process. And this is quite simple. That's all done through the Health Data Nexus platform. You'll need to get approval from all the authors and upload the actual data. We'll do a quick copy edit pass, and then the data will be published on the platform. So that's a quick rundown of everything involved as far as the data upload process. Now that's all of the structured information I have for the dataset grant. I want to leave a lot of time for questions because I'm sure you have some. I also want to leave a little bit of time just to show you what Health Data Nexus looks like. So I will maybe take a second here, and I also have a few like frequently asked questions as well. If there aren't questions in the chat, we can go over those. But I'll just take a pause here, and based on everything we've talked about, and based on the information so far. What questions do people have? Feel free to post them in the chat. Feel free to unmute and ask them directly, and I will answer to the best of my ability.
Thanks, January. Yeah, I've got a quick question. So we've got an ongoing CHR grant that we plan to deploy on Health Data Nexus at some point. With regards to the grant application, which hands up haven't looked at fully through yet, does it have to be already collected data, or could be an ongoing initiative?
So it can be an ongoing initiative, or it can be a like completely new process.
Okay,
Basically, like it will be the grant itself will be reviewed per kind of the like uh kind of depth of scientific value and everything like that. Yeah, this can be a program that you've already begun, or it can be sort of something that you've want to start using the funding from the grant.
great. Thanks very much.
I see a question in the chat about becoming a T-CAIREM member. Thank you so much, Soriana, for responding to that. Yes, you can very easily, just with a few clicks, become a member of T-CAIREM so that you can apply for the grant. Any other questions right off the bat? I'll maybe just, while I still have this up, just kind of scroll through some of these FAQs. I highly recommend for anyone who's interested in checking out the call for proposals, which is online, as well as there should be a link to the FAQ that's there that is a little bit more replete as far as frequently asked questions. Now might be a good time, again, just while we're waiting, and do feel free to continue to post any questions that you have in chat. I'm just going to switch my screen to the actual Health Data Nexus, just to give you a sense of what it looks like.
Thank you, January. As you're doing that, just to clarify that last question, can data be linked between different data sets? Like, are there unique identifiers that can link, or is it not because they're totally de-identified?
Good question. Thank you. And I'm realizing that question, I think, got cut off early. Yes, so we do not generally allow linking between different individual data sets on the platform. So each data set can have its own sort of identifiers, like sort of a de-identified patient number in a sense, so that you can reference that across say different tables.
Right.
But in general, two different data sets on the platform cannot be linked in order to prevent linkage attacks. If there was interest in, taking two separate data sets and combining them in some fashion, that is something that we are theoretically open to. It would probably mean starting a conversation with the author of the other data set, and then working on a proposal collectively to then link those two data sets in some new form.
Okay. And maybe one other question, just in terms of the ISIS data set, is this at all linked, or can it be linked, or no, it's completely independent of that?
So for the ICS data?
Yes.
Yeah. In general, no. We don't allow linking across different platforms.
Okay.
We could, if there's value in linking an existing like data that you're generating as part of the grant to an existing data set, I think that would probably need to be part of the project, is like creating a sort of linked data set using that data. But because Health Data Nexus and ICS have different like requirements as far as access and like data security, and we all have kind of our own like different ecosystem, that would need to be like an explicit part of the project, is linking those.
Thank you.
Mhm. I think my screen should be sharing now. Um, and actually, I just see another question in chat, so I'm going to field this one now. In the proposal, should we explain the specific AI algorithms that can be developed to analyze the generated data? Is it one of the evaluation criteria that those AI algorithms should be novel, with algorithmic novelties explained in the proposal? That's a really good question. And it sort of depends. Like, we don't want to be too prescriptive as far as how the data that is collected should be used. However, it is very helpful once you have a data set that's been generated and a data set that's been put on the platform. It is very helpful to provide really well built out usage notes that help individuals analyze those data. So I would say that you should mention it in the proposal. It doesn't need to be a significant part, because we're much more interested in the scientific rigor that goes into the creation of the data set rather than into the analysis that follows. However, if you can allude to that, that would be very relevant for if the grant is accepted. That would really help build out the data set description and help make it useful to others. So I would say mention it, but it's probably not going to be the top focus of the application, if that answers your question. So I'll turn my attention here to this screen just to show you what Health Data Nexus is. Feel free to follow along, healthdatanexus.ai. You're welcome to kind of follow along on your own browser. But I'll just mention, like, we have here, like I said, sort of a catalog of different data sets. And you can look at these different data sets. Let's look at an example that actually came from the previous round of data set grants, which is our sleep laboratory data. This was one of the recipients of the previous round of dataset grants, and you can see that the dataset description includes an abstract, background, methods, data description, including kind of detail about all of the different data that's included and linking out to description, as well as usage notes about how the data can actually be used, in this case, in a Python research environment. I see a question in the chat, so I'll take that. We have REB approval to fully open source our data. Is it acceptable that the data sharing is not restricted to Health Data Nexus? Yes, so data does not need to be restricted to Health Data Nexus. However, I would say that in general, the data set is the grant is going to prioritize, or at least focus on, the approach to generating the data set. And the grant funding is primarily intended for, the creation thereof. So if you already have a fully open source data set, then that's probably going to reflect in the application that there's kind of um, less rigor that needs to be put into the approach to data set generation. However, we're not opposed to, if the process of creating that data set ultimately leads to an open source data set that an open source data set that you want to host elsewhere. We're not opposed to that, and you're welcome to host that elsewhere as well. Yeah, any other questions here? I'll maybe just turn back then briefly to the Health Data Nexus here, just to walk you through the process a little bit and give you a bit more of a sense of how this is done. log into the Health Data Nexus is done either through your institution or using your ORCID ID. So it's accessible to researchers all over the world. Basically, any institution that you could use with EduRoam, you can use with Health Data Nexus. So I'm just going to log in here. And you can see that once you're logged in, you have access to a research environments page. This is where you create all of the analytics platforms once you've already gotten approval. So there's a credentialing process that you can go through, basically signing off on a data use agreement for the individual data set, as well as completing any required trainings. Once that's done, you have access to the data. And I can just go to launch a research environment. I can pick any of these data sets, such as the sleep lab data. I can decide sort of the computing power I want to put behind it. I can work in either Python or Jupyter for Python or RStudio. And then I can also decide, what amount of data storage or if I want to attach a GPU as well. And I can go forward with creating the environment. At this point, it becomes identical to using something like Jupyter Lab or RStudio on your home machine, just in the browser and running off of Google's compute. There's a few other features as well, like events. This allows you to credential large numbers of users for something like a workshop or course or datathon. And that's just another feature that you might be interested in, or we might cross that bridge once we have the data up on the platform. So that's a little bit about Health Data Nexus, just so you have a bit of a visual sense of what it is and what we're looking at here. I'll maybe just pause again and check any other questions.
Hi.
Hi.
If it's a 1-year grant, how much needs to be completed in that 1 year? How much of the grant can focus on sort of defining the data, especially in the case of a multi-center data collection? How much of it do we need to have a completed data set at the end of the aim for a completed data set at the end of the grant period, or can the grant be used to structure the data collection moving forward?
Yeah, good question. So the grants are intended for a 1-year duration. That can be extended to 2 years, but the funding will only be distributed across the first year. So I would say that as long as you have a really solid plan for finishing the creation of the data set as well as the upload process for the second year of the grant, yes, you can use the first year primarily to structure the creation of the data set. Just be aware of that 2-year deadline.
Great, thanks.
Mhm. Okay. The first criterion says clearly specify the data set that will be generated in the context of healthcare data collected from patients. Does generated here actually mean collected? Yes. Generated in the sense of, collected and collated and de-identified and the kind of whole process of putting the data set together. Yeah.
And again, is there any difference between prospective and retrospective data? Any preferences there?
Nope, both are totally fine and acceptable. If you're working with prospective data, typically what we would do is we can upload the data in batches. So if you have sort of, here is the first year, first several months, first period of our study, we can upload that. And then going forward every few months or every year, we can upload additional data up to the platform. We don't have the capability right now for sort of a live streamed upload, like a kind of a live feed of data, but we can, discretize and segment that out over, a period of several months or years.
Yeah, I have a similar question about prospective data. So could the grant be used to propose kind of a platform for the collection of data that would happen longitudinally? So perhaps by the end of the 2 years, there would be some data available, but really the focus of it is establishing the collection platform for a rich data set.
Yeah, I think that would be reasonable. As long as, and I think the grant would need to emphasize that we would need to have some sort of like upload ready data set by the end of the 2 years. So I think it's fine if the bulk of that goes into creating a novel platform. I think that would definitely be a reasonable use of grant funds, but it would just need to be structured so that some of that data was ready to upload by the end of that period.
Thanks.
Mhm. Yeah, really grateful for everyone's questions, everyone. And just a reminder, this session is being recorded, and the recording will go up online. So if you showed up late or if you have any questions that were answered in the first part of the session, you will be able to review those later. One final call for questions. Okay. I think we will probably call the info session there then. Just a reminder that the deadline for the grant is October 10th. So you have exactly a month to put together the application. If you do have any questions, I'm always available over email and I try to respond pretty quickly. I'm just going to put my email in the chat. So feel free to get in touch. Again, the session will be recorded, so look forward to seeing that as well on the T-CAIREM YouTube. Please do get in touch with us. Join T-CAIREM if you're not already a member. You'll, of course, need to do so for the grant, but also you'll learn about all the other great activities that we're up to as a center. So highly recommend that. You will not regret it. And just a big thank you to all of you for attending and for speaking up and asking great questions. Every year, the process gets a little bit smoother, and it's because of the great involvement of everyone here. So thank you so much, everyone. I look forward to seeing your fantastic applications, and don't hesitate to reach out if you have any questions. So thank you so much.